Welcome to this audio video class on the Unit 37 of our course, Sociology of Health and Illness. In this unit, we will discuss about the meaning and types of disability. Dear learners, it is estimated that 1 billion people, about 15% of people globally, experience one or other form of disability which leads to adverse outcome. The prevalence is high when it comes to developing countries. Disability is a complex issue which is also multidimensional. Persons with disabilities may have varied needs and capacities, and they also have the same rights and equality like any other person in society. Too often, their lives are impaired by physical and social barriers in society which hamper their full participation. It is important to have a comprehensive understanding of disability and other related concepts. This unit, therefore, shall discuss these aspects along with types and causes of disability in context of India. So now let us understand the meaning of disability. Disability is a word used in daily conversations that holds different meaning for different people. The experience of disability is unique to each person, but there are common impacting factors. Opinion on what constitutes disability may vary. Considered as a medical problem, a sin, or a curse, have to live with it, etc. These views leads to how society accepts people with disabilities, which unfortunately results in stigma and discrimination. This transition from an individual medical perspective to a structural social perspective has been described as the shift from a medical model to a social model in which people are viewed as being disabled by society rather than by their bodies. A person with disability may be unable to perform certain functions just as efficiently as most other people. The disability may be physical, it may involve senses including seeing or hearing, it may involve finding it difficult or impossible to think clearly, or it may involve mental health. Long-term physical, mental, intellectual, or sensory impairments may result in physical and social barriers that interfere with their functioning and participation in daily life, leading to a life of complete dependency in many cases. Now let us try to know some of the definitions. The World Health Organization defines disability as an umbrella term covering impairments, activity limitations, and participation restrictions. Impairment is a problem in body function or structure, and activity limitation is a difficulty encountered by an individual in executing a task or an action, while a participation restriction is a problem experienced by an individual in involvement in life situations. Thus, disability is a complex phenomena reflecting an interaction between features of a person's body and features of the society in which he or she lives. The preamble to the Convention on the Rights of Persons with Disability 2006, adopted by the United Nations, describes disability as a result from the interaction between persons with impairments and attitudinal and environmental barriers that hinder their full and effective participation in society on an equal basis with others. Now let us try to know some of the concepts related to disability. Concepts of disability have evolved over the past few decades. The focus of attention has shifted from disability as a state, a consequence of disease, to disability being included as just one of many components of health. It is observed that many terms are used to refer to disability like impairment, handicap, that are most commonly or interchangeably used. But when we examine what these terms actually mean, it is found that they have different connotations which are important to be discussed so that it leads to a better understanding of the world of the disability and how these terminologies are interconnected. The most commonly cited definitions are those provided by the World Health Organization in the International Classification of Impairments, Disability, Handicap, which provides a conceptual framework for disability in three dimensions, that is, impairment, disability, and handicap. Let us discuss them. First, disease. Disease refers to any harm in the functional state of an organism that deviates it from the normal structure or function and is generally attributed with a set of signs and symptoms that differ from any physical injury or accident. Then comes impairment. Impairment is any loss or abnormality of physiological, psychological, or anatomical structure or function. It occurs at the organ or system function. For example, any defective body part, amputated limb, paralysis after polio, limited hearing, etc. Then comes disability. Disability is any restriction or lack of ability to perform any activity in the manner or within the range considered normal for a human being. Disability is concerned with functional performance or activity affecting the whole person. Impairment leads to disability in the sense that the person may have a problem or difficulty in speaking, walking, hearing, or doing any such task due to any bodily impairment. Then comes handicap. Handicap is a disadvantage for a given individual resulting from impairment or a disability that limits or prevents the fulfillment of a role that is normal depending on age, sex, and social and cultural factors for that individual. The term handicap focuses on the person as a social being and reflects the interaction with and adaptation to the person's surrounding. A disability becomes a handicap when it interferes with doing what is expected at a particular time in one's life. Thus, impairment refers to a problem with a structure or organ of the body, and disability is a functional limitation with regard to a particular activity, and handicap refers to a disadvantage in filling a role in social life. A person with disability, therefore, as per the Rights of People with Disabilities Act 2016, means a person with long-term physical, mental, intellectual or sensory impairment which, in interaction with barriers, hinders his or her full and effective participation in society equally with others. Now let us discuss some of the causes of disability. Many factors can be attributed to disability and it can originate at any stage in a person's life, be it before birth, during or after birth, which are complex and heterogeneous. Now let us discuss about them. So first let us talk about the prenatal causes, which refers to those before birth. Genetic and chromosomal abnormalities play a significant role in causing disability that is inherited. For example, X and Y chromosomal factors can lead to Down syndrome. Developmental malformation, maternal illness or infections, age, malnutrition, state of mother, any injury or fall of the pregnant mother, consanguineous marriage, any exposure to radiation or chemicals, ingestion of drugs, tobacco, alcohol, and overuse of medications by mother during the pregnancy can cause these factors. Then comes lack of access to appropriate health during pregnancy due to poverty and other reasons can affect the child, leading to low birth weight and other complications are some of the prenatal causes. Then comes the perinatal causes. These are those that occur during the birth process, which are mostly biomedical causes. Babies born with low birth weight or premature are at the great risk of developing congenital abnormalities. Complications during delivery, trauma during labor, poor treatment, lack of experts to handle the delivery, and lack of essential facilities are some of the causes. Oxygen deprivation for the child during the birth is another major reason that can lead to permanent disability in a child. Then comes postnatal causes. Postnatal causes are those that happen after birth. Environmental factors play a major role here where accidents, injuries, conflicts, war, risky work environment, breathing or drinking toxic chemicals, etc. are responsible for most of the disabilities in people. Illnesses such as meningitis, polio, measles during childhood can lead to permanent disability that lasts throughout life. Now let us discuss about different types of disability. First, locomotor disability. Inability to execute distinctive activities associated with movement of self and objects resulting from affliction of nervous system or both can be termed as locomotor disability. Then comes leprosy cured person. A person who has been cured of leprosy but is suffering from loss of sensation in hands or feet, eye and eyelid, extreme physical deformity as well as advanced age which prevents him or her from undertaking any gainful occupation can be one form of disability. Then comes cerebral palsy, a group of non-progressive neurological condition affecting body movements and muscle coordination caused by damage to one or more specific areas of the brain, usually occurring before, during or shortly after birth. Then comes dwarfism, a medical or genetic condition resulting in adult height of 4 feet 10 inches or less can be termed in as dwarfism. Then comes muscular dystrophy, a group of hereditary genetic muscle disease that weakens the muscles that move the human body, and persons with multiple dystrophies have incorrect and missing information in their genes. This prevents them from making the proteins they need for healthy muscles. Then comes acid attack victims, a person disfigured due to violent assaults by throwing of acids or similar coercive substance can come under this category. Then we have blindness. It is a condition where a person has total absence of sight or visually acuity less than 3 by 60 or less than 10 by 200 in the better eye with best possible correction or limitation of the field of vision subtending an angle of less than 10 degree. Then comes low vision. It is a condition where a person has a visual acuity not exceeding 6 by 18 or less than 20 by 60 up to 3 by 60 and up to 10 by 200 in the better eye with best possible corrections or limitations of the field of vision subtending an angle of less than 40 degree up to 10 degree. Then comes the category of the person considered as deaf. Persons having 70 dB hearing loss in speech frequencies in both the ears. Then comes the people considered as hard of hearing. Persons having 60 dB to 70 dB hearing loss in speech frequencies in both the ears. Then comes speech and language disability. A permanent disability arising out of conditions such as aphasia affecting one or more components of speech and language due to organic or neurological causes comes under this category. Then we have intellectual disability. It is a condition characterized by significant limitation both in intellectual functioning and in adaptive behavior, which covers a range of everyday social and practical skills. Then we have specific learning disabilities, a heterogeneous group of conditions wherein there is a deficit in processing language, spoken or written, that may manifest itself as a difficulty to comprehend, speak, read, write, spell, or to do mathematical calculations, and includes such conditions as perceptual disabilities, dyslexia, dysgraphia, dyscalculia, dyspraxia, and developmental aphasia. Then we have autism spectrum disorder. It is a neurodevelopmental condition typically appearing in the first 3 years of the life that significantly affects a person's ability to communicate, understand relationships, and relate to others, and is frequently associated with an unusual or stereotypical ritual or behaviors. Then we have mental illness, a substantial disorder of thinking, mood, perception, orientation, or memory that grossly impairs judgment, behavior, capacity to recognize reality, or ability to meet the ordinary demands of life, but does not include retardation. Then we have multiple sclerosis. It is an inflammatory nervous system disease in which the myelin sheet around the action of the nerve cells of the brain and the spinal cord are damaged, leading to demyelination and affecting the ability of nerve cells in the brain and spinal cord to communicate with each other. Then we have Parkinson's disease. It is a progressive disease of the nervous system marked by tremor, muscular rigidity, and slow, imprecise movement, chiefly affecting middle-aged and elderly people, associated with degeneration of basal ganglia of the brain and a deficiency of the neurotransmitter dopamine. Then we have hemophilia. It is an inherited disease usually affecting only male but transmitted by women to their male children, characterized by loss or impairment of normal clotting ability of blood so that a minor wound may result in fatal bleeding. Then we have hemophilia. It is an inheritable disease usually affecting only male but transmitted by women to their male children, characterized by a loss or impairment of the normal clotting ability of the blood. Then we have thalassemia. It is a group of inherited disorder characterized by reduced or absent amounts of hemoglobin. Then we have sickle cell disease. It is a hemolytic disorder characterized by chronic anemia, painful events, and various complications due to associated tissue and organ damage. Hemolytic refers to the destruction of the cell membrane of the red blood cells, resulting in the release of hemoglobin. Then we have multiple disabilities. Any other category may be notified by the central government can be considered as disability. Now let us try to discuss about the changing types of disability. As the concept of disability is constantly evolving, and so the types, it has been increasing over the years, and many forms of disabilities gets included in the list approved by the central government. In the Persons with Disability Act 1995, only 7 types of disabilities were included. But with the latest Rights of Persons with Disabilities Act 2016, it has extended covering 21 types of disabilities. The new list of recognized disabilities include blood disorders and acid attack survivors. Intellectual disability, Parkinson's disease, cerebral palsy, dwarfism, and autistic spectrum disorders are also included in the list. This change in the types of disabilities is reflected in the Disabled Population Census. Question on disability was included in all the censuses of India since 1872 till 1931. It was not part of the census data from 1941 to 1971, and then in 1981 census, data related to 3 types of disability, that is blind, totally crippled, and totally dumb alone was collected. In 1991, disability data was not collected, and in 2001, only 5 types of disability numbers, that is disability in seeing, speech, hearing, moving, and mental disability were gathered. This further extended to 8 types in 2011 census, where mental retardation, any other, and multiple disability was included to the existing list. Different kinds of disability in the Act are classified based on medical grounds and not on social perception of disability. With different types of disabilities being included, it is envisaged that the people with disabilities will be able to have access to all the rights, opportunities, and privileges enshrined in the national and international conventions that enable them to lead a qualitative life and maximize their full potential. So dear learners, in this video we have discussed about the meaning and different types of disability. Thank you.